Welcome to the harmful effects of tobacco products and passive exposure training. At the end of this training, you will have knowledge about the harmful effects of tobacco products and passive exposure. By the end of this training, you will be able to define tobacco products, recognize other harmful substances in tobacco smoke, understand the harms of tobacco use, explain passive smoking, describe ways to quit, and note healthy living points. So, what is tobacco? All products made from tobacco leaves, either entirely or partially, for the purpose of smoking, inhaling, chewing, or otherwise consuming are referred to as tobacco products or tobacco goods. The Law on the Prevention and Control of the Harmful Effects of Tobacco Products, number 5727, was adopted by the Turkish Grand National Assembly on January 3, 2008. This law prohibits the consumption of tobacco products in enclosed spaces. In Turkey, cigarettes are most widely used, followed by hookah, cigars, and pipes. Rolled and chewing tobacco have local use. Smoking or inhaling causes psychological and physical dependence. Nicotine is the main addictive substance. Smokeless tobacco that is sniffed or chewed also contains high levels of toxins, as high as nicotine. So, what is a cigarette? A cigarette is a tobacco product made by rolling shredded tobacco in paper and consumed by inhaling the smoke. It is the most widely used tobacco product in our country. There are over 4,000 carcinogenic and toxic substances in cigarettes. As a result, tar asphalt forms in our lungs. There are more than 4,000 chemical substances in cigarette smoke. Cigarette smoke contains nicotine, carbon monoxide, numerous carcinogens such as arsenic, lead, polonium-210, benzene, nitrosamines, formaldehyde, chromium, nickel, and various irritants and poisons. There are other harmful substances found in tobacco smoke. Examples include acetone, cadmium, methanol, butane, ammonia, arsenic, and deadly poisons like cyanide and naphthalene. Smoking contributes to heart and vascular diseases, lung disorders and COPD, vessel blockage and stroke, gastritis and ulcers, skin yellowing and wrinkles, dental discoloration and bad breath, and pregnancy risks including premature birth and developmental issues. Smoking is linked to multiple diseases affecting various systems of the body. Cigarette affects every member of the body. Effects of smoking on the respiratory system is crucial. Upper airway, chronic sinusitis, chronic pharyngitis, vocal cord nodules, hoarseness in women, and laryngeal cancer. Lower airway, recurrent bronchitis, higher pneumonia and tuberculosis risk, increased asthma risk, chronic bronchitis and emphysema, and lung cancer. Lung cancer is the leading cause of cancer-related deaths. The risk of lung cancer is 20 times higher in smokers than in non-smokers. Chronic bronchitis is present in 50% of smokers. In patients with bronchitis, morning cough and phlegm production begin first, followed by shortness of breath, respiratory failure, and heart failure in later years. Smokers are 3 times more likely to have a heart attack. Smoking impairs circulation, increases stroke risk, and may lead to leg gangrene. In female smokers, risks include miscarriage, premature birth, low birth weight, and infertility. Heart attack risk increases with birth control pill use. Nicotine and its metabolites can be present in breast milk. Smoking increases the risk of peptic ulcers and related deaths, and is also associated with gallstones. Smoking causes bladder and kidney cancers and is the strongest known risk factor for bladder cancer. Risk decreases after quitting. Smoking is the most important risk factor for oral and laryngeal cancer. Smoking increases the levels of lactobacilli and fungi in saliva, degeneration of gum and bone tissue around the teeth, preparation of the ground for the formation of cancer in the mouth. As a result of vasoconstriction in the capillaries of the face, reduces skin nourishment and oxygenation, causing early and irreversible wrinkles. Smokers lose bone density. Fractures occur more easily and heal more slowly. Hip and spine fracture risks are notably higher. Smoking increases the risk of cataracts. People who smoke more than 20 cigarettes a day have twice the risk of developing cataracts. The risk increases proportionally with the amount smoked. The addictive effect of nicotine in cigarettes is a powerful substance. Even people who try smoking by chance are likely to become addicted. Nicotine reaches the brain within 7 seconds of inhaling a cigarette, stimulating the brain and nervous system. It makes you feel good and causes you to want more nicotine. Smokers develop hand and mouth habits. The more cigarettes smoked per day, the stronger the habit. There are several ways for quitting smoking: quitting on your own or using medically proven treatments. To quit on your own, set a quit date, inform those around you, anticipate challenges, remove cigarettes and related items, focus on the benefits, and engage in new activities. Under professional supervision, medications, including nicotine replacement therapy and bupropion, can support cessation. Nicotine replacement therapy relieves withdrawal symptoms in addicts when they quit smoking. It comes in different forms like nicotine patch, nicotine gum, nicotine nasal spray, nicotine cartridge. Bupropion HCl is a nicotine-free medication that has been included in treatment guidelines. It is effective in the brain. It helps reduce nicotine withdrawal symptoms that occur when quitting smoking. Common symptoms include restlessness, insomnia, tension, difficulty concentrating, overreaction, irritability, fatigue, trembling, headache, constipation, dry mouth, increased appetite, and weight gain. Benefits follow a timeline. Within minutes to days, heart rate, blood pressure, and carbon monoxide levels normalize. In weeks to months, breathing and circulation improve. In years, heart attack and lung cancer risks fall markedly. Within hours, nicotine declines. Within days to weeks, senses and circulation improve. In months, coughing and shortness of breath decrease. In 5 to 10 years, major disease risks drop substantially. A passive smoker is a non-smoker exposed to smoke. Exposure increases risks for diseases including cancer, heart disease, and COPD. Children are especially vulnerable, and even short exposures can have harmful effects.